Hi, I'm Dr. Rahman, and welcome to Today's Woman. There's a recent news report about a new type of birth control, pill. But let me step back and just say that birth control pills are a very effective form of contraception, and they work by suppressing ovulation, meaning that if you don't release an egg, it doesn't matter how much sperm is introduced into your vagina. And so birth control pills are effective because they prevent a woman from ovulating. Very effective, 99% effective when taken correctly. However, a lot of women don't like the idea of taking hormones, and they don't like the idea of having to take hormones every day because, make no mistake about it, there's nothing holistic or natural about birth control pills. They're hormonal manipulations designed to keep you from ovulating, and they do that job really well. But like I said, some women don't want to take birth control pills every day. And then there's the plan B, or the emergency contraception. There are hormonal contraceptions that are given after a sexual encounter, possible exposure, possible risk of pregnancy. Again, hormonal contraception, it's primarily given to prevent implantation of a fertilized egg. And so hormonal manipulation is a very effective form of birth control, but some women are wondering, is there an on-demand oral contraceptive? Because a lot of women have now gravitated towards the long-acting reversible forms of contraception, such as IUDs and Nexplanons. But even still, a lot of women kind of don't like the idea of having something inserted into their uterus or implanted in their arm, and they're thinking, no, I want a pill, I just don't want to have to take a pill every day. And so this new form of birth control is a birth control pill that you take on demand when you feel like you need it, and not necessarily every day. And the idea was that this would make women more compliant, but it would only be effective if it was able to suppress ovulation, because just taking hormones in and of itself isn't the answer. The hormones have to be taken in such a way that it prevents ovulation, the release of an egg. And if there's no release of an egg, it's effective. So this new form of birth control was just recently tested on a very, very small group of women, a total group of 9 women. They were given the pill, which was a combination of 2 medications, uliprisol and meloxicam. One is a selective progesterone hormone receptor modulator. The other is a non-steroidal anti-inflammatory medication. So these 2 were combined into one pill, and they were given to women and around the time of ovulation. And 6 out of the 9 women, ovulation was suppressed. And so the thinking is, just maybe, it's way too premature to say definitively, but just maybe there may be a time when women take hormonal birth control pills on demand and don't need to take them every day. I don't know if that's a benefit. What do you think? Again, this is Dr. Rahman talking about contraception, birth control, because your body is magnificent and your health is priceless. Take care.